come here every time I can to be inspired by what you do and to show everybody I know about what you do. I was telling the majority leader that we had the speaker here just last year to see some of the innovations in Denver Health. And I know everybody in this room should know that Dr. Gabot is recognized as an expert in public health, not just here in Denver or even in the region, but nationally. And she's even been in front of Congress, in front of my committee, to testify about how you can provide quality health care to indigent patients and do it in a way that saves money and comes in under budget. I just wish that we could bottle what we do here at Denver Health, Steny, and that we could take it nationwide, because what we would have is a high-quality healthcare system that serves everybody and that does it in a cost-effective way. So kudos to you and your entire team. I know you have many of your team members here, and kudos to all of you for what you do. We wanted to come today to talk about what healthcare reform has done for Colorado families, because it's so important, and you are on the front lines. You see it every day. Denver Health does every day what a lot of people thought was impossible, and that what we're trying to do when we implement this new health care bill. It provides high quality care while struggling with an overwhelming number of patients, many of whom actually don't need hospital care but have no other way to obtain that type of care. We're going to tour the emergency room right after this. And in Denver Health's emergency room, there's an unbelievably talented team of doctors, nurses, and attendants who treat every single person and treat them with dignity, regardless of what their condition is and regardless of their insurance status. Now, the care that these folks get is exemplary, but the cost is also very great. Denver Health will likely spend $350 million this year treating uninsured patients, many of whom have to rely on the emergency room for primary care because they can't get that care in other places. That cost impacts everybody in our society, whether or not they have health insurance, because all of us have to pay when our public safety net hospitals have to treat uninsured patients. Thanks to the health care reform bill that we passed earlier this year, that will become a distant memory. One day in the not too distant future, the ER team here will be able to focus on what they do best, which is providing emergency care to patients. As components of the bill come together in the next few years, the number of uninsured Colorado families will plummet, and so will the number of people who have to seek their primary care in the emergency room. Instead, those families who will now have insurance will be able to get care from primary care doctors, such as those at Denver Health's outstanding community health centers. And Denver Health is also going to get a lot of help from this bill to give more resources to the community health centers, which is the best place not only to treat most illnesses, but to prevent illnesses that people who are uninsured wait until happen. And so as healthcare reform becomes a reality, the challenges that we face here at Denver Health, and most importantly, the challenges that these families face, like the woman who came and testified in front of our committee who lost her health insurance because she got a promotion at her janitorial job, and so she couldn't take her little boy to the doctor. She had to wait till he had a raging ear infection to take him to the emergency room. Those horrible feelings and those horrible health outcomes will be a thing of the past. And that's good for hospitals, that's good for patients, and that's good for everybody. So I'm really happy to be here. I'm really happy to be at sort of the hub of where all of this happens in Denver. And I'm really happy to be able to bring another one of my colleagues here, Majority Leader Steny Hoyer. Steny has been a mentor to me, and he has been a friend for many, many years, ever since I went to Congress in 1996. And he is a large part of the reason why we have a health care reform bill in this country right now, and why we're beginning to implement it, because he wouldn't give up on the patients of America. And as Chief Deputy Whip, I worked with him and the Speaker and the rest of the team to to make sure that we passed a bill, that we did it in a cost-effective way that's going to save money as we begin to implement this legislation. Without further ado, he hates it when I do this, but let me introduce my boss, Steny Hoyer.